Definitely a celebration, Cool and the gang, but maybe not for Shehzad.
For some, not all. For some. Today.
Yeah.
A few people rubbing it in. A few Liverpool fans rubbing it in today.
Because we saw how upset you were, we can't ignore these
People want to know why Shehzad sad. What is the deal?
Yeah, I probably should give the context, right?
Yes.
A disappointing football result that ended just as we went on air. So, and we lost to our big rivals. Very controversial. If I was a Liverpool fan, I might want for a replay, but I'm okay. I get over it. We're not sensitive.
We talk about very important things on the show, and Shehzad's feelings is one of those.
And someone who might be able to talk to Shehzad about his feelings,
yes.
Dr. Natasha Riard. Welcome to the studio. Are you a football fan by any chance?
I am a wife of a football fan.
He's okay. He's not that into football.
Liverpool all the way. Sorry, Shehzad.
Oh, Lord. His day is not getting better.
He's actually sitting right next to me off camera, by the way, if you're watching us on Facebook Live.
Alrighty. So for today, it is day 2 of a very special week here on the Brightside. We're shining the spotlight on autism, and there's just so many aspects, to this, diagnosis, this disorder as well. And for today, we're going to talk about the parent involvement, especially if their kids have recently been diagnosed, and what it entails, what they can look out for, and maybe how overwhelming it can be navigating your way for caregivers like parents. So I'm going to ask first, so what would you advise parents upon diagnosis of ASD or other intellectual disabilities, because it can be very overwhelming? Your advice, Dr. Natasha?
Actually, what I kind of want to bring up is that not so much like the diagnosis, but the first time you hear that word. Yes. Because I think you go in, you think, okay, my child's like not talking, and then I'm showing up and I'm expecting just speech and language therapy, for example. So I want to differentiate between that time that first person tells you, hey, actually, after all the screening and all the information you give us, autism, like we think it might be that, versus when you officially see that psychologist who's doing that standardized assessment and has that report that says, all these things meet that criteria. So not even about like the diagnosis, but just hearing that first word, is enough.
Sure.
Right? The moment you hear it. Yeah. So my, I guess in some sense, solicited advice, I hate giving unsolicited advice. But since you asked, feel all your feelings. You have a right to all your feelings. So, parents some of them are, actually they're quite relieved, some of them. They're like, oh, thank you. Like you give us this word that really now like puts things into perspective. But then you have this other side who look at you like you've just given them a death sentence. And some of them say that. They say, you say this thing almost very lightly to me, but it's a death sentence. And you have to hold that space for them. I'm going to list a bunch of emotions now. So, like shame, guilt, fear, blame, regret. I think they might even feel judged, like they think it's their parenting, something they did wrong, Did I eat something wrong when I was pregnant? Did we do this wrong, that wrong? And I think they feel alone and very lonely.
Sure.
And definitely very confused. So I think at that first stage, whoever that is bringing up that word or whoever that they can go and talk to, allow them to say the things that are on their mind, no matter how difficult. Like, nobody wants to hear it, but I think parents are allowed to find that person that they can trust to even say something like, I don't know if I made the right decision having a child. Like, I regret it.
Yes.
Like, I wish we didn't do this at all.
Okay.
Let them say those things because they can't keep that inside.
Yeah.
They have to tell somebody that they trust. It doesn't mean they don't love their child.
Yes.
I think we kind of want to go like, hey, don't say that, but then who are they going to tell it to?
Yeah.
Yeah. So two things can be true at the same time. You can have regrets. You can wish certain things, but you can also love your child. Those things are not separate.
Yep.
Yeah.
If I may add to that list that you just mentioned, I think denial was certainly one that I went through personally, with a number of the other things that you mentioned, and you find it hard to accept at first, and you think, it's going to be okay, or there's nothing wrong with my child. How do you help parents?
That's a $1 million question right there. my role is primarily training these psychology interns who are going to one day be clinical psychologists. And in the past, I've trained home visitors like at Kid Start and who work with parents, right? And obviously, I work directly with parents as well. I would say acceptance is a journey. And I use this, I don't know if it's metaphor or analogy, but it's like going from Pasir Ris to Tuas Link. That journey itself, right, is already very long, very long journey. And for some parents, you just go straight to it. So they get on at Pasir Ris and like, okay, yeah, we accept intervention, la-di-da. And, in, 1 hour or something, 1.5 hours, you reach Tuas Link, right?
Yep.
And for some parents, you know that's the journey, but you just think, how do we get from Pasir Ris to just like Tampines? How or Simei? Like, what is that next step?
Right.
Yeah.
Take it step by step kind of thing.
Step by step. So you meet them at where the parents are ready.
Okay.
Yeah.
I think that's great because the whole thing can be very overwhelming.
We are chatting with Dr. Natasha Riard, and she's a clinical psychologist with over 10 years of experience to talk about autism and intellectual disabilities for our very special series this week. Join us on Facebook Live. Okay, we're there right now. You can ask us your questions via the comment section. Okay, it's facebook.com/1FM913 or WhatsApp us your questions as well, 88550913. The chat continues.
Hey everyone, a very good morning to you as we continue our chat with Dr. Natasha. Remember, if you chime on in with your comments, your questions on Facebook Live, it might just win you a $100 dining voucher from Aegea Okonomiyaki restaurant. And there you go, I got my 10% discount. Hey. All right, next question.
So Dr. Natasha, can we just reiterate the sense of blame and guilt that a lot of parents experience at this point? How can we help them process that?
It's really listening to them, validating their emotions, because they have a right to feel those things, to kind of say, yes, I think it makes sense that the first thought that you have is blame or regret, and allow them that space to talk about it. And I think where necessary, give them the information that they need, because sometimes it's just about knowledge. It's like letting them know, actually, it was nothing that you did. Like, these are things that just happened. So some knowledge, whatever that they're open to. I think what I want to kind of say is that, and this is what I tell like the future psychologists or whoever, is if you're having a debate with a parent about diagnosis, you're having the wrong conversation. You're having the wrong conversation, because especially I think in Singapore, you don't necessarily need a diagnosis to get intervention, because you're just looking at that delay or certain things that need to be worked on, right? That individualized kind of plan. So you can hold off on talking about diagnosis till some point. They might need it when it becomes functional. You need it for school, for example. So if you're coming in 2 years old, 3 years old, right? Just don't debate it.
Okay.
Turn that conversation to what is important to you as a parent. Like now I bring up this word, right? This, big A word to you, and what is important? They'll say, a school. I just want to make sure that my child can go to a mainstream school.
Okay.
So no matter what the kid is in front of you, whatever their level of functioning, you work backwards with the parents. Okay, good. You have a goal. You want that mainstream education, right? Okay, this is how it looks like. So this is how a child who goes to mainstream would look like. Let's work our way back to the first step. Let's just do this on the journey to your goal.
So reverse engineer it in a way.
Yes, because I think if all you see is just, I want to go mainstream education, I just want to go mainstream education, you forget that this child still is at that first step. You got to get them to the next step and the next step.
Before you can get to that mainstream, right?
Yeah.
That's a really, really good point, and I think, this is a great reminder to all those involved, the healthcare, the doctors, the healthcare staff, to just have a bit more compassion and empathy, and to first and foremost focus on the parent. I think that's also great advice for maybe yesterday. I think it was William or Willie who asked about, what about the friends of the parents? How can they help, or how should they react? I think this is great advice here.
Actually, I was just thinking that earlier on, like, how can we hold space for them? We talk about holding space. I think maybe as a friend who is, maybe a fellow parent or not even a parent, what are some of the things we should or shouldn't say? Yeah.
Okay. I think what I might kind of focus on is that every parent's fear. So in this whole 10 years and having, when you used to work in a restructured hospital, you're diagnosing like every day. So every day you're saying this word, autism, 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 sometimes multiple times a day.
Yeah.
And in conversation with them, that fear that they have, and this is a fear that every parent has, when I am gone, can my child take care of themselves?
Right.
Yeah.
Actually, that's all they're thinking.
Absolutely.
So when they think about mainstream education, actually deep inside they're just saying, I need my child to be able to be independent and take care of themselves.
Right.
Yeah.
So I think when you're talking about how to like support or hear, right, is if you are a parent, find your kampong. Find those people that you know can be that help for you, right? And if you are that friend, be the kampong. Like, be that person who is like, what do you need to what can I do to help you feel secure that your child will be taken care of? So I think, and this is just me, is once a child is born into this world, it is everyone's responsibility. I'm not saying full responsibility, but it is everyone's responsibility. The parents, friends, extended family, teachers, therapists, MPs, ministers, everybody's responsibility, because it's that fear. Will my child like be in a day activity center
Sure.
when they're adults? Who's going to take care of them?
I think this is, you hit the nail on the head. That's all we think about in my house as to the future of our 7-year-old. And also, that's how that phrase, it takes a village to really help someone like that, a child in need. It really is an effort that requires more than just the two parents.
Yes.
Absolutely.
I would say that it takes more than one village, and per child.
Okay, a few.
The whole
Yeah.
country.
Yes.
We'll get there.
We're running out of countries. I have 3 boys. We ran out of countries. So I'm struggling right now. But we're going to head back on air, and maybe we can share about what you just shared here on Facebook Live. So everyone come and join us on 1FM 91.3. We'll catch you then. I love this song from China Crisis. Wishful thinking here on the Brightside. A very good morning to you. Day 2 of our Autism Week here on the Brightside, and we're joined once again with Dr. Natasha.
Just a quick moment of levity before we dive back into this. Earlier, Dr. Natasha had used sort of the metaphor of traveling from Pasir Ris to Tuas Link, right? And how parents go on this journey. Gurmit says anyone who has to travel from Pasir Ris to Tuas Link really will need therapy.
I tell you, our Brightside is they've got such a great sense of humor as well.
He's always, he's always on
thanks
that.
for that.
Nice one.
But yes, we were talking on Facebook Live about the kind of support that parents and caregivers will need, especially when the diagnosis is made known to them. And you shared something really, really powerful, that when every child is born,
it's everyone's responsibility. Yeah, we all have to find a way to really help parents feel more secure and that their child will be taken care of. Yeah.
because you were saying that maybe parents might have these concerns about like, oh, will my child be able to go to a mainstream school? But it's actually something deeper, right? Which is, will my child be able to be independent and take care of themselves and survive after I'm gone, right?
Yes, exactly. That's their number one fear. And it's something that, how I was in like the first 3 years of my career or the first 5 years is very different from like how I am now.
Yeah.
I remember like, let's say breaking the diagnosis, and one of like the number one questions that they ask is, what about NS? Because a large proportion of children who are diagnosed are males. And I'm sitting there going, NS? I thought I was going to talk to you about intervention, but wow, your mind just kind of zoomed. NS. So I think that's how I started having these conversations, like, you are saying something, right? And parents' minds are exploding into...
Because they've got all sorts of things going on.
Exactly.
Yeah.
So that's why they need that space to like tell you, I am worried about NS. It's not ludicrous. Like, don't look at me like I'm telling you something that is strange.
Right.
Like, these are my real concerns.
Real concerns,
Sure.
yeah.
Yes.
Sure.
So don't dismiss it. So I think if you're going to be part of that kampong that's listening, let them say those things. It's real to them.
How can parents or caregivers be supported, Dr. Natasha? What's out there?
Wait, what exactly? In
terms of how can, from a psychological point of view,
Yeah.
I mean, you've talked about the community around them has to rally around, right?
Yes.
What else can be done? I mean, I know there's Caregiver SG, and we're going to be talking later in the week about that. But what other things can be done, like practical speaking?
Okay. I think one is that the Enabling Guide has, there's a website and there's actually a link to it that has all these informal support groups. So I think when you're talking about finding your kampong, like those are the things, really start reaching out. I think going to those very like local websites and finding those support groups, taking part in even like recently there was a St. Andrew's, Autism Center walk.
Right.
Do that. Take part in that, because when you go there, you will see your community.
We did the Run for Inclusion last month, and then there was the Purple Parade just on the weekend. There's lots of things out there actually.
Yes.
And it was really good to feel part of a community, I have to say.
Yes. I think then you realize that, yes, in some sense, you might feel alone, you might feel lonely, but when you get into that community, I think it relieves some of that. It's like, oh, hey, can I talk to you? I noticed that your son was doing this and my son was doing that, and you need to...
There's a solidarity there, right?
Yes, because no matter what, if you're a neurotypical parent having neurotypical children, right, it is not the same. Yes, there might be similarities, but I'm going to put it out there. You will not understand.
Right.
You're knowledgeable. You will not understand because you don't do it every day.
No, these are really, really great points you're bringing across here. We're going to carry on this conversation on our Facebook Live. Come and join us, okay? Facebook.com/1FM913. Hey everyone, how's it going? Welcome back to the Brightside. Our Facebook Live discussion continues with Dr. Natasha as we shine the spotlight day 2 of our Autism Week.
We were just asking Dr. Natasha about what can be done to help parents and caregivers. And actually, Dr. Natasha, you'd actually mentioned to me before we went on air that there are these informal support groups, and we're going to be putting that information up on Facebook, right? Tell us a bit more about that.
I think it's just a way for parents to kind of go there, I think scroll through it and join the Facebook groups, click on those links. I think some parents even tell me that they have this WhatsApp chat groups that they go into. So I think it's a good avenue for them to, at least you're talking to somebody
who understands.
Yeah, who understands and has that same experience,
Dr. Natasha, how can we put this message across to people, public or caregivers, that the diagnosis shouldn't be viewed in a negative light?
Wow. Very tough questions today. I'm going to be straight up and I'm going to say we are part of the problem, because diagnosis is deficits-based. In the diagnosis, it's deficits in socio-emotional reciprocity, deficits in nonverbal communication, deficits. Yeah. So how do we then tell people, hey, don't think about it negatively when I just spent 2 hours with you and your child
using all this word,
looking for deficits, right? Looking for all the things that are, not normal or whatever, however people want to bring it up. So I think that we have moved as a society, but not enough. So a prof once told me very long ago at this, the start of my career, saying that when he first started, right, disability was seen by everybody as a broken bottle in a factory, throw it. So when when it first started, intervention wasn't even part of the process. It was stick them in somewhere, just put them aside, right? It's a broken bottle. What do you mean you need money for intervention?
Wow.
Just throw the bottle, right? But we have moved so far because now we're let's fix the bottle, right? But even then it's not enough, because currently I think our idea is, how can we fix the bottle such that it will look like a bottle? And we need to move towards, actually, can we be creative about what this bottle can be? Does it still need to be a bottle?
Does it need to be like the rest?
Exactly. So I think we are, in talking about neurodiversity, we're moving towards that language. No more bottle. It's broken, or it's whatever that you want to call it. It's chipped here and there.
Accept it for what it is.
Can it have a different purpose?
So you're saying even in your assessment protocols, maybe the use of deficit can be looked at as well?
Yes. So I'm not saying don't intervene, right? That there's no problems at all. There's nothing wrong. I'm not saying that. They do need support. They need our help. They need all those accommodations we can give them. But the language has started to change. Because I work with autistic adults who are in the profession, and I love having those conversations with them, because they're the ones that say, can you not talk about us like this? Can you say like, these are our preferences, right? That I maybe prefer to look at objects compared to like looking at somebody, because it's the language that needs to start changing. So even my language has started to change. We've come a long way from having pages of recommendations that's like, these are ways to improve your eye contact, these are ways to like get your kid to socialize. We're trying to make them into that bottle.
Right.
Sure. So our language needs to change about how can we, like, if there's a chance to be collaborative and in talking to parents, help them, be happy and satisfied and accept themselves and function as a society in that kampong.
Right. No, it kind of reminded me of what you shared yesterday, with kids that are on the spectrum or, being diagnosed, that it's not about normalizing them. What is normal? And I feel like that's coming across here really, really clearly with what you just said. And I feel like this also launches us into the question of, how can you help parents, caregivers, to sort of reconcile with the fact that their child will have this condition for life?
Oh, no. I don't know how to do that. Besides, I think giving them that time and space, that's why they really need that kampong, because sometimes one person is not enough. Like, they need to then talk to somebody else, because it's all inside their mind. I think it's going back to that Pasir Ris to Tuas link again. It's a journey. It's not like I accept or don't accept. It's you're moving that station each time. And I think that's one of the biggest challenges that I've had in having this conversation and working with parents, is that actually some of them can accept the diagnosis, no problem.
Okay.
They accept the intervention in that sense, but they're still not accepting their child. So they're coming to intervention, and their goals would be, I need him to work in a group, and when his friends talk to him, like, you need to teach him what to say. Yes, we can do all of that, but I think it has to be mindful of what that child needs and wants as well.
Actually, on that note, I was curious, Shehzad, how have you actually reconciled, the fact that this is something your son is going to have to deal with?
I think Dr. Natasha was spot on. It's a process. It took a while. I didn't want to accept it at first, even though I was the one who prompted my wife. I think there's something a little bit out of the ordinary with our son. But when we got the diagnosis, I was like, no, but he's fine. And it took me a while. However, what I am grateful for is, as Dr. Natasha pointed out, you really need people to rally around you. And that really meant a lot to me. And when we started doing the therapy, and the improvements were huge, he was speaking, with speech therapy made a big difference. And then we did the early intervention very, very fast. I was, where my son was at 3 to where he is now, and Lavi, you've met him before.
He's a delight, by the way.
He can't stop talking now. From someone who couldn't talk very much, he won't stop talking. But, we have embraced him. What I struggle with sometimes, and I think you made a very good point about sometimes we have to accept the child. I sometimes forget his condition because of his gregarious. He doesn't. How he exhibits his autism is maybe not what people often think of. Whenever I mention autism to people who don't know it, they think Rain Man. I'm sure you heard this all the time.
Yeah.
Right? Dustin Hoffman, the movie. And it's a spectrum. The whole point is there are people all across. And because my son doesn't have necessarily those sort of signs or exhibit those sort of indicators, I guess, people often don't realize it until he does something a little bit different. And then everyone starts to go, oh, okay, so he's not quite the same as everyone else. He's not neurotypical. And I forget it. So I and then I treat him like the other son, and then I have to just pull myself back and realize he can't help himself.
Right.
Yes.
And that sometimes I have to just remind myself.
Yes, I think actually that's really good advice. I think that whole idea of, it's like that first thought, second thought that I talked about in the when we first met to talk about
I love
co-regulation.
Yes,
Yeah,
that was
it's
great.
a very compassionate
So
stance.
when you're in it, right? Okay, I don't want to be that person that brings up Taylor Swift. I'm sorry to tell
okay.
everybody that
But you're
I
a big
am.
Swiftie.
I am the Swiftie of Swifties. I love her so much.
Are you going?
Yes, I am.
How about the movie?
We'll get there.
Okay.
I want to bring this up because she's such a good lyricist, and in her song "Happiness" off of the Evermore album, she says.
I like the detail here.
I use her lyrics to train my interns.
Yes.
She goes, "When I'm above the trees, I see this for what it is. But now I'm right down in it." So, when you pull yourself back and you're up there, you're above the trees, you have perspective, you have objective, and you go, "Oh, my child is autistic. I understand this behavior.
Yeah.
Okay, get it." But sometimes, right, when you're in it,
Yeah.
that's the only perspective you see. I think parents are on that just road to normalizing, or you forget.
Yeah.
You're in it. So do the first thought, second thought if you can, to kind of pull yourself back and go,
That's
I need
very
to be
good point.
up above the trees.
Yeah.
Right.
Taylor Swift said it.
Yeah. Hey,
See the
I
woods from
think
the
Carol
trees.
was the one who pointed out about how there's a university in the States studying Taylor Swift
Swift
songs. And that's an actual module, is a degree or
Yeah.
something?
They're looking
It's a
for a
module.
clinical psychologist, I heard.
Yeah.
Oh, yeah?
No, but you're doing well. You're doing
So
well.
they're
James
looking
Cook
for
University.
an
They're
adjunct
all happy.
lecturer.
Could
Yes.
deconstruct all the lyrics.
I can.
Yeah.
I think she already
I
has,
will.
by the way.
Yeah.
Sounds
There's
like
already
she-
a book lying in her shelf somewhere.
I'm writing the paper.
Who would have thought? Day 2 of our Autism Week, and it's now shining the spotlight on Taylor Swift. But she does write very good lyrics. I'll give you that. Okay, I'm very envious that you're going for a concert. Tried to get tickets, couldn't. But we're going to head back online for our final questions, just to wrap things up for Day 2. Please come and join us on 1FM 91.3.
Her concert is like a gathering of dolphins, by the way.
Oh, sorry?
It's like,
No, la.
incessant screaming.
They do not sound
All
like
these
that.
I
dolphins.
think they do.
Really?
Yeah, yeah,
What?
yeah.
Present company excluded, of course.
My earbuds were
Roshan's going to
ringing.
be there. at the
Yes. He's going to get
What?
grief from me, her husband.
Here we go. Back on 1FM 91.3.
Phil Sharkey there with A Good Heart, which is exactly what you need when you have a parent of a child with autism or intellectual disabilities. But as Dr. Natasha pointed out, it's not always easy to reach down in there, and you go through so much, right, Dr. Natasha? It's a process, an ongoing, a life process.
Yes. Pasir Ris to
To
Tuas Link. And once you get to Tuas Link, then you got to go somewhere else. So the journey doesn't end there.
But you see the woods from the trees when you get to Tuas, something like that, right?
Yes. You're above the trees,
You're above the trees.
when you
Okay.
get to Tuas.
We just found out that Dr. Natasha is a huge Swiftie fan of Taylor Swift, and she's got tickets to the concert. And also, she was sharing with us some beautiful lyrics that can really help, parents on their journey, caregivers as well, if they have a child who is diagnosed or recently diagnosed.
Go on, you know you want to. One more time.
Ready.
One more time. So Taylor Swift has this lyrics in her song Happiness off of the Evermore album, and she goes, "When I'm above the trees, I see this for what it is, but now I'm right down in it." So I think that's like a nice reminder to everybody that if you're able to pull yourself up and pull back and get some distance, there's objectivity and perspective there. But also that understanding that when you're in it, when you're in the trenches, it's hard to see anything else except for your own line of thought.
Dr. Natasha, so with early intervention, right, skilled professionals such as yourself, you know exactly what you're doing, and you can be objective, right, in dealing with the child. It is, yeah. You're smiling there for a moment. So how can parents create a similar environment at home?
I think Shehzad, did you kind of want to share?
Yeah, I want to hear what you say, so then I can say, oh yeah, good, I'll just take that off you.
I'm doing that. That's what I'm doing.
No, I mean, look,
I caught that.
it's what I find very interesting for my son, Zavi. He is at school. He is a certain character. They absolutely adore him to bits, and he's very well behaved. But when he comes home, he's a whole other creature. He doesn't want to listen. He acts out. He has meltdowns. And that, when we go to the school to talk to them, because there's therapy in the school, they are like, who is this person? Because we don't see it here. So, and we don't know how sometimes to deal with that, because he is he can be very, very difficult at home. But it also shows to me he can regulate himself. And so that gives me hope.
Right.
Because if he was acting out in both places, then that's a lot harder to deal with. But he knows where his comfort zone is, and where the authority is. So I guess I don't have enough authority. But yeah, well, I mean, I don't know. I mean,
I'm
I
so
guess,
glad you brought this up.
Yeah.
What you just described is actually masking.
Right.
He's masking in school. So you're saying he has the ability to be regulated,
Yes.
right? But he's regulated by that structure, by maybe even fear, like I'm not in my safe zone.
Oh.
So I better mask, try my best to be like, what is everyone doing? Just do that. Even if I
Right.
don't understand it.
Okay.
Right? Because maybe they don't pick up on that social cue or something. They're masking. And masking is so tiring. Like imagine you like, you know, it's like you're going to work all day and then you're like, I'm going to be me, Shehzad, the work Shehzad.
Bright-eyed, you know.
And then, so actually, what you need to do for him at home is let him be him.
Okay.
Because he's been masking the whole day. He needs to come home and just be like,
Oh, he's shattered, is it? I'm done.
I'm done. I'm home. You know, when he, treats you a certain way,
Right.
it's because he knows you love him.
Oh.
You are his secure
Safe space.
yes, you are his safe haven.
Yeah.
You are the secure attachment. You're like, dad is here. I can just
Let it all
loose.
out.
Let it all out.
me.
Yeah.
Thank you for sharing that, because I
Yeah,
think
that's really good.
it's for all parents of all
Yeah.
kids, you know. I feel bad that now I'm telling my son, hey, stop it.
You're allowed to feel bad.
Huh?
But actually, that's a good. Actually, just want to pick up quickly on that.
No, I
Neurotypical.
don't mean that negatively. I mean, it's
You know, there's a very
okay.
good Taylor Swift lyric. No.
Yes, I must go and listen later.
But seriously, even for neurotypical kids, they're also masking in a way, aren't they? So
Yes.
they're also acting up, because when they're back home, then they also let it up, because there's peer pressure as well, isn't there?
Yes, there is. So parents, actually, our job is to be that safe haven.
Okay.
So that they can feel secure to go out, meet those challenges, and then come back. We cannot be like the school teachers or whoever at home. So I have this conversation with parents where it's like, just imagine one day they're 16, they're 17, they're out. How old do you start clubbing? I don't know. But you get into some kind of problem. I'm sorry, I think it's 18.
Let's go with that. Let's go with that.
And your child gets into trouble.
Yep.
Who do you want their first phone call to be?
Of course, you.
Exactly.
Yeah.
So you have to create that safe haven for
Right.
them that's like, no matter what, I accept you. I can scold you, I can nag you, I can be unhappy with you, but I always love you and I accept you for how you are unconditionally.
Okay.
You call me because I'm going to help you. Like,
Yeah.
I'll scold you later, but I'll help you first.
Yes.
You are always my priority.
Unconditional, right? Unconditional love.
I gotta
Yes.
get that printed on a T-shirt. I love you unconditionally, and then behind it goes like, I'll scold you. But just to help parents, so create that safe haven. But are there rules to it? Like, hey, there's a time limit. I'll let you
Yes.
shatter for one
Yeah.
half an hour. How do we
You're
do
spot on.
it?
You're spot on.
How do we do it? You know?
Yeah. So I think in my training, if I can condense it, it's like 4 things. You have unconditional acceptance. You give them the autonomy they can handle.
Okay.
They need that independence,
Yeah.
that choice. I want to do this. Realistic expectations. Really know your child. What is it that they can and cannot do? Be realistic. And then reasonable limits. So I think what happens is that we put reasonable limits first. We're like, these are all the limits. But it goes like that.
In that
First-
order.
The first, okay, fine, I'll say it. I'll say it. Like,
Go
I don't know if it's in that order specifically,
Go
but
on.
unconditional acceptance, autonomy, realistic expectations, and then you have those limits. Yeah, meet them first, their needs. And then they need the limits because, we live in a boundary life. Like, we can't just do whatever we want with no consequences.
I took down notes.
Okay.
I'm going to study later. No, because parenting, even though I've got 3 kids, I'm sure a lot of parents feel they don't really know what they're doing, because I clearly don't,
It's okay,
And
I
day to
still
day.
don't. Because I'm in it. Sometimes I'm in it. I'm the parent, I'm not the professional.
You got to go rise above the trees.
I
you
will
see.
try,
Like, you gotta look
Shehzad.
down.
I will try.
Taylor told me to tell you that. Yeah. Right. Thank you so much, Dr.
Really good today.
Natasha.
Thank you. Really, really
But
interesting.
you'll be back tomorrow, and day 3, the topic and theme is...
Oh, this is a hot button one. It's about education for special needs and autistic kids, intellectual disability kids, and what paths they can take.
Yes.
So we'll see you once again. Come and catch her and our conversation, not just on 1FM, but also on our Facebook Live in the hour of 8, and some weather and traffic updates next.
Good time. Greatest hits. 1FM 91.3.